Hi there, I'm Dr. Elisabeth K. I'm a scientist and a rare disease patient. I do have scleroderma and dermatomyositis in overlap, and I have secondary Raynaud's. And there's many different reasons why I think we should invest significantly more money and resources into rare disease research, but these are my top three. The first one is that we need to understand what triggers them. So for example, with scleroderma, we think it's multifactorial. So for example, that genes do play a role, but also outside factors such as, for example, nutrition, chemical exposure, stress, etc. all might play a role, and we don't really know. The second one is that we need to start to understand why it's mostly women becoming autoimmune diseases in comparison to men. In diseases such as Sjögren's, it's 9-to-1 the ratio, so that there's 9 women to 1 ill male. And so we need to start to understand why there is this significant basically sex bias. And then the third one is that we need to understand why certain patients respond to treatments and medications and others don't. This is called patient stratification, and it would help us to really understand why certain patients respond to certain treatments, but also maybe that we can make predictions. So if we start to look at someone very early in their disease, we might be able to predict what pathway they will go down. So for example, will they become a lung involvement? Will they have more skin involvement, etc.? And so there's many different avenues that we still need to discover and understand, but these are my top 3 reasons why there should be significantly more investment into research.